Hello, students. Good afternoon. I'm Professor Henderson, and I will be your instructor for the summer semester, teaching you fundamentals of nursing. So, I wanted to create this quick video to give you an overview of this course and what it all entails to deepen your understanding of fundamentals of nursing. So, let's dive right into it. So the goal of this course is to integrate cognitive and psychomotor domain of nursing using evidence-based practice to enhance active learning. So as you know, as nurses, we all use evidence-based practice to support our practices as nurses. Um, Integrate cognitive and psychomotor. So, as you know, you'll be taking several exams, which is the cognitive component of fundamentals of nursing, and you will be required to use critical thinking to answer these nursing questions. And a lot of them are on the application. Some of them are application based, some of them are able to knowledge base. So psychomotor domains. So we will be teaching you different skills in our skill lab. We'll be teaching you how to insert a Foley catheter, how to administer an intramuscular injection or a subcutaneous injection, and how to monitor patients' blood glucose level using a glucometer. So that's a psychomotor component. So NUR 101 introduce students to classroom, laboratory, and clinical experiences to enhance student skills to be a competent nurse in ever-changing healthcare environment. So the classroom, we will be exploring, we'll be teaching you the didactic. We'll be having lecture on the different chapters. We'll do some group work. We'll do some concept maps. We'll do some case studies. In the laboratory, the skill lab will teach you how to do a sterile dressing, how to insert an NG tube, how to insert a Foley catheter, so on and so forth. Um, Clinical experience. Students are required upon completion of the fundamentals of nursing. You're required to do 5 weeks of clinic, clinical skills, such as we'll be taking you to the nursing home, and you'll be working on the unit. You'll be able to practice your theoretical knowledge. You'll be giving medications, administering insulin, and doing a dressing, and so on and so forth. So, moreover, this course utilizes a conceptual framework of Oram self-care deficit model to improve patient care. So, what is Oram self-care model? So, Dorothy Oram self-care deficit theory provides nurses a model to guide their nursing practice. According to Oram's theory, patients are able of self-care, and the nurse's action is to assist clients to assume responsibilities for their care. So a lot of the institutions and a lot of hospitals and long-term care facility platform is based on Oram self-care theory. So methods of evaluating the didactic. So we will have throughout the semester, which runs for 15 weeks, we will have unit exams. We'll have 3 unit exams, and each one of the unit exams are worth 15%, which is equal to 45% of your total grade for 3 exams. So I would like to emphasize it is critical that you study real hard to pass these exams because in the beginning of the class, the material is a little bit more, it's not that difficult as, you progress throughout the different chapters. So if you're doing exam one, try to score a high percentage so at the end of the semester it wouldn't be a strain on you to really, bump up your grades. So 3 unit exams, 15% each, equal to 45%. We will have weekly quizzes, 5 weekly quizzes, and each quiz is worth 1%, so a total of 5%. So the final exam is worth 25%, and the specialty test is worth 10%. So the specialty test, it's an online module that you'll be log into, and you'll be taking an exam. These questions are meant to mimic NCLEX style questions, and it's time. I think it's an hour and 30 minutes to do questions. I'm not sure how many questions, but it's probably about 1 hour and 30 minutes to do the modules. So these the unit exams, the weekly quizzes, the final exam, and the specialty tests, it's your objective grades. So what do I mean? I mean that you must earn a 78% on the 3 unit exams, weekly quizzes, final exam, and specialty exam. You must earn 78%. Now these assignments at the bottom here are your non-objective grades. So you have the evolve practice assignment, it's 1%, evolve practice test is 1%, and you have evolve case study, which is 4, it's worth 10%, and you have NCLEX RN question online 250, which is worth 3%. So in order to get the credit for these assignments at the bottom here, you must obtain a 78% on top here in order for the credits to kick in, or the grades to kick in for these at the bottom. So it's important that you understand that you must earn a 78% on the objective grade in order for these to count into your grade. So the mastery skill validation is either a pass or fail. The clinical also is a pass or fail. So some of the skills you will be testing in validation is how to give an intramuscular injection, how to insert a Foley catheter, how to give a subcutaneous injection, and how to do a Z-track. All right, so teaching methodology. This course utilizes a variety of instructional methods to enhance student learning and are as follows. So, as I said earlier, we'll be lecturing on the different chapters. We'll have open discussion, assign readings weekly, concept maps, case studies, role playing, videos, group work, demonstration, and return demonstration of skills. So these teaching methods are meant to deepen your understanding and help to promote critical thinking. So this is some of the textbook. We use Potter and Perry, 2017, and we have this other one here, Ignatievica's Workman, 2015, Clinical Companions for Medical Surgical Nursing, 8th edition, Elsevier. So it's important that you get these textbook in advance and start to read up on these chapters because it can be quite overwhelming if you want to enhance your grade and you want to do well in fundamentals of nursing. Get the textbook early, try to map out the chapters and try to study, and not just memorizing the content in the chapter, is reading the chapter and able to apply the knowledge. How do you apply this knowledge as a nurse? Because as a nurse, it's important that you develop critical thinking and critical reflection. You will be required to do so when you work in a clinical setting. So I'll see you in class, and I hope you find this little video informative and engaging, and I hope it helps to clarify a few of your misconceptions about fundamentals of nursing. Um, you will receive the syllabus from me in another few days or so. Thank you so much.